I'm Dr. Surena Namdari from the Rothman Institute. I'm a shoulder and elbow surgeon, and we're here at the American Academy of Orthopaedic Surgeons annual meeting. We're here presenting research that we've done at the Rothman Institute centered around shoulder surgery. The two main topics that we've been looking at involve infection after joint replacement, as well as pain control after joint replacement in the shoulder. And our studies have shown that there are certain pain management strategies that are effective when it comes to treating patients after they've had a rather complex surgery. And our hope is to minimize narcotic utilization, as there is a large opioid epidemic that we are trying to combat. And so some of the strategies that we've developed have demonstrated in our research to be highly effective, and we've employed those at the Rothman Institute. Similarly, as it comes to joint infection, it's a fortunately rare but unfortunate event that can happen, and we've developed ways to accurately diagnose infections in the shoulder, which can be challenging to both diagnose and treat. Joint replacement.